Maria. My name is Kara Cowles. I'm a physical therapist assistant that'll be working with you. So today we're going to do some bed mobility, so moving you over into the bed to your right side because you look a little over to the left. Then we're going to be getting you up from supine to sit. So I'm going to have you show you a couple ways to sit up. Then we're going to get you off of here, have you sit in this chair, and then walk 12 feet out, 12 and a half feet out, 12 and a half feet back. Okay? Do you have any questions before we get started?
I don't think so.
All right, is it okay if we get started?
Yes.
Yes, okay. So just to be sure, you did have your right leg, or you had a right total hip replacement.
Mm-hmm.
So you are 50% weight bearing for when we get you up. Do you remember your approach that you did?
Mm-mm.
Okay, so you do have a posterior lateral approach, so which that means we have to watch hip flexion to past 80. So this would be hip flexion to 90. So like sitting in a chair, we always want to make sure your knees are below your hips. And then we don't want you to be, when we get you up, I want you to have a slight back extension. So we're not flexing to break that hip of 80 degrees. We don't want your knees to touch. So that's hip adduction. We don't want you to cross your ankles or cross at the knees when you're sitting or lying down. And we also don't want you to turn your toes in for internal rotation. Okay? So when we get you over for bed mobility, I'm gonna have you move over to the right side of the bed. I'm gonna move your shoulders over. I'm gonna have you bend this left leg, push off with that left foot, and then I will be guiding your right leg over. Again, I want to make sure you do not break that hip flexion of 80 degrees, so kind of just stabilize as much as possible. Okay? Any questions?
Nope.
No? Okay. So I'm gonna take you out of this abductor pillow. And again, this abductor pillow is to make sure that you do not do adduction or bring your your knees in.
Okay.
So I'm gonna have you flex this foot for me. Good. And then you're gonna push off of that left, and I'm going to move your shoulders over on the count of 3. 1, 2, 3. Good. And then I'm gonna be moving this abductor pillow with you to your left side. On the count of 3, push through your left foot. 1, 2, 3. Good. How'd that feel?
Good.
Good. Can I have you lower this leg for me? So you did not go into 80 degrees hip flexion, so that was good. And you also did not rotate your hips. Okay, so the next thing we're going to do is have you get sitting up. So for this, I'm gonna have you get on your elbows, and then right when I turn you, you can go to your hands, but again, don't break that hip flexion 80 degrees. So again, not right here. I kind of want you about this height.
Okay.
And then also make sure you don't cross your legs or rotate your hips anyway.
Okay.
Okay? So I'm again bending this leg, push in, well, I'm not actually bending this leg this time. You're just gonna get on your elbows, and I'm gonna guide both of your legs over to this side.
Right.
Okay? So any questions?
Nope.
No? Okay, so you can get up on your elbows. All right, and then at count of 3, I'm just gonna have you move towards my side.
Okay.
Okay? So 1, 2, 3. Make sure you're leaning backwards, not breaking the. Good. And then we can actually have your legs, you can bend your legs here, but we're just gonna get you back laying down so I can show you the next one. Okay, so we'll just get you back. Back down. So that looks good. You didn't rotate, you didn't break that 90 degrees. So next, we're gonna do that same thing, but we're gonna get you up with the walker and sitting into this chair.
Okay.
So I don't want you to break those hip precautions. Again, bending, flexing the hip to 80 degrees, or turning your knees in, toes in. Don't do that either, or crossing your legs, especially when sitting down, because I will remove the adductor pillow.
Okay.
Okay? So when we get you sitting back up, I'm gonna have you just kind of slide down on the plinth with your bed, and you're gonna land on your left. You're gonna place your left foot down first, and then your right. You are 50% weight bearing, so you can even out distribute that. You do not want for you to go over to your right. So just really distribute that. And when you get down, you're going to grab on to the walker, place your foot down. I'm gonna have you take one step forward. It's gonna be walker, right leg, left leg, and you're stepping 2. You're getting out of step 2, not through.
Okay.
Okay? And then I'm gonna have you go towards this seat with your strong side, so your left. So I'm gonna have you go walker, right leg, left leg. Try not to really rotate or turn those hips, just little small movements. Walker, right, left, walker, right, left, walker, right, left. And then we're gonna have to have you turn just a tad to your right side, just so we can get you seated. So it'll be walker, right, left, just small little movements. And then I'm gonna have you go backwards, which is walker, right, left, walker, right, left. And then when you feel the chair, the back of your legs, I'm gonna have you lift up, we'll reach back and lift up that right leg so we're not wavering through it. And bend your back a little, we'll arch your back so we don't break that hip precaution, and just slowly sit down.
Okay.
And then you can put your leg back down.
Okay.
And then from there, I'll show you how to ambulate. 12 out,
Okay.
12.5 out, and 12 back.
Alright.
Any questions before we get you up?
Nope.
Okay, and I will be putting a gate on you just so I can have something to hold on to.
Okay.
Alright? Okay, so I'm gonna have you get up on your elbows again. We're gonna kind of get you up. Okay. So again, count to 3. Just gonna have you move this way. So 1, 2, 3, up on your hands. If need be. Try not to break that hip precaution. 8 degrees. Good. So I am gonna have you scoot more towards me. Just a little bit off, just push through. Good. We'll stay there for about, we'll stay there first. I'm gonna put this gate belt on you. You feel safe here to let me take my arm off you? Okay. Again, this is just for the safety of you and me. Let me know if it gets too tight. Okay.
Okay.
Does that feel okay?
Yeah, it feels good.
Alright. So I'm gonna come to the other side and get your shoes. I can put your shoes on. Again, just for the safety of walking. This side for you. Okay. So. And is it okay if I take my hand off you? Just put this on. Okay.
You might have to shove them on.
Okay.
It's a long hanging.
Good.
So close. Almost there.
She's gonna untie it.
That's gonna help. Yeah.
Okay. Sorry if I mess up your
That's okay.
shoelaces. You're still doing okay?
Mm-hmm.
Feel safe and comfortable?
Yes.
Alrighty, so then I'm gonna get this other shoe on for you. Easier if I do it this way. Alrighty, and I am gonna peel on my hands because I touched your shoes. Okay, so now that we have you seated, I'm gonna take the abductor pillow out. And then you are able to bend your legs. Just try not to move your knees in. We do not want you to break your hip precautions before we get you up. Hip precaution would be flexing your hip. We don't want you to do that. We don't want you to bring your knees in, toes in, or cross your legs when we're sitting down. Okay. this over to you. Again, you're gonna slide down with that left leg at first, and well, I'll move it to the other side of you real quick. Then slide down onto that left leg, making sure that that leg doesn't touch yet until that left leg's down. Again, keeping the hip precautions. Good. Almost there. Okay, you can grab the arms, walker. Lightheadedness, dizziness.
No, I feel okay.
No, good. Okay, so I'm gonna have you move the walker out, and then
50%.
yeah, 50% weight bearing. Walker out, right leg, left leg. Walker again, right leg, left leg. Again, make sure you're not gonna twist, because I am gonna have you turn that way just a tad. So have your walker go that way. Right leg, tiny movements, not twisting. Good. Good. Do one. Actually, we'll do two. One more. Good. So now we're gonna go backwards. So bring the walker back. Right leg, left leg. Again, make sure you maintain 50% of that weight bearing status. And we'll take one more step back. Alright, do you feel the back of the chair? Feel it now?
Yeah.
Okay. Alright, so again, when you sit down, I'm gonna have you bring your arms to the armrest. Place that right leg out, kick it out in front of you, and make sure you don't break that caution of 80 degrees of flexion. Just kind of arch your back. And you're getting down. Good. Feel safe there? Okay. Alright, and you can bend that leg if you want to.
Okay.
Just make sure you're not breaking that 80%.
Okay.
So now we're gonna have you walk 12.5 feet out and then back.
Okay.
Okay? I do have a chair there just in case you need to rest.
All right.
So we're gonna move out. Walker, right leg, left leg, walker, right leg, left leg, walker, right leg, left leg, and we're gonna have to turn around. So we would like to turn on your left side. So we're gonna move walker, right leg, left, walker, right leg, left, walker, right leg, left, until you get back to this same position. I'm gonna have you come back again, straight, walking with the walker, right leg left, walker, right leg left. Then I'm gonna have you turn. So we're gonna turn walker, right leg left, walker, right leg left. Again, always making sure we come back to that left side.
Okay.
Okay, any questions?
Okay.
Alright. Place this walker here, try not to go onto the walker, you're pushing off. With the armrest, again, not breaking that hip precaution of hip flexion. Good, you can grab on. Feel lightheadedness, dizziness?
No, I feel good.
Okay, and you can place that foot down, so we're gonna take a few steps out. We're gonna have to go at an angle and then a few steps back. So walker, right leg, left leg. Making sure you're doing a step 2 gait pattern, not step through. Good, 3, 4. Something okay? Putting 50% weight bearing through that right leg. Okay. Now we're gonna turn to this side, so walk on the right leg. Try not to twist, small movements. Any pain?
Just a little bit.
Okay. Nothing unbearable?
No.
Okay, so now we're gonna go back forward and sit back in that chair. Left leg, walker. Again, step 2, 50% weight bear. So come out just a tad, just a little bit. Just seated, and I'll get you back up onto the plinth.
Okay.
So when you turn, I'm gonna have you turn it now. So walker, right leg, left. Walker, right leg, left. Walker, right leg, left. 50% weight bear. I'm gonna, would you like to sit on the plinth or the chair?
Maybe the chair.
The chair? Okay. Are you sure? You need a break first, or do you wanna go to the plinth?
I think we can go to the plinth.
Okay, okay, so we'll back you up. Go. Walker right leg left. Walker right leg left. You should feel the plinth, so when we when you put your hands down onto that, you can just push off with that left leg back up. Okay? Push up. Good. Try not to break that hip caution of 80. So again, when we get you up in the chair, the plank, just make sure you kind of push backwards. Okay. All right, so I'm gonna have you, if you're able to, scoot back just a tad, just kind of shimmy on back. Good. So I'm gonna place this abductor pillow just right in here. So I'm gonna go underneath. Come under you as well this way, and shimmy this back over here. And I'll fix it when we get more in place. Let me get you. Okay. Now I'm gonna remove your shoes. Okay. I'm just gonna untie them again. You're welcome. Okay, I'll take the ski pad off of you and get you back laying down. Okay. So again, don't break those hip precautions at 80 degrees, just kind of slowly go backwards. Okay. Feel okay?
Yeah.
All right.